Hi, it's Gepina here, chiming in for lymph flow, answering questions that you have about lymphatic drainage. What is one of the top questions that I get asked every single day? When should I get lymphatic drainage after a surgery? My opinion is you should start getting your pre-op lymphatic drainage 2 weeks prior to surgery. And the minute you know you're going to get surgery, I recommend coming in for a consultation so that I can walk you through how we can customize your experience accordingly to your body and your life. The reason why I recommend a pre-operative session for you is that we're able to do a lot of preliminary treatment, like working on fascial tissue and current lymphatic congestion areas along the hips and the side of the body where generally clients are getting their liposuction done, so that we can start to get that to flow and empty out. So when you do the lipo, when you're doing your procedure, your body essentially is a clean canvas. Post-surgery, you can expect to have swelling pretty much immediately, and that's not a bad thing. That's part of the body that is working on recovering and healing. The body is working really hard to get you back to normal, so don't stress if you start to get swelling, if you feel a little bit of pain. This is all normal. So post-operative, we have 3 phases that we work on over 6 weeks. I recommend getting in within 3 to 5 days of your surgery. First phase is getting you out of that fight flight of being on the surgery table for anywhere from 3 to 6 hours, depending on what you're doing. So we want to help you feel relaxed. We want to help you calm down from your surgery. And then we want to help to start opening the lymph nodes that are inundated with fluid so that they can take up the new fluid and start to drain correctly. Once you have your first drainage, you usually start to immediately have pain relief, because part of the swelling is what causes the pain that's hitting on all of the nerves inside of your body. So that's like the first week, is swelling and pain. Second week, you start to see the swelling and the pain go down. You want to keep monitoring, the drains in your body. Make sure that there's not going to be any infections. The first 2 weeks, if you're going to get an infection, it can happen. Again, this can be a normal part of surgery, so it's no need to stress out. Another good reason why it's good to be seeing your lymphatic drainage therapist right away, because they can, they're not licensed to treat wounds, but they can monitor the wounds and know the signs of infection, like redness and swelling that's not going away. Unusual oozing around the wound, and then we would refer you right back to your plastic surgeon, and they would decide whether they want you to forgo lymphatic drainage right now or continue lymphatic drainage with care. But wounds are something that can happen. They rarely happen, but this is just part of natural process of any kind of surgery that you have. So again, nothing to worry about, and again, something that lymphatic drainage can actually help to move that fluid out of your body so that your body can dump in the right kind of immune response that it needs to heal the wounds. So we do see our clients heal really well from wounds, and rarely will it become really badly infected. So second phase of plastic surgery is we're starting to deal with, okay, now that your swelling's down, your pain's down, how can we start to work in the areas to avoid cording or fibrotic tissue that will start to stick and stay, that can become lumps and bumps, or it can be long, hard cords. These generally will show up in lipo areas, underneath the armpit, along the side of your hips, because these are areas where there's a lot of lymph congestion, and it's areas that we tend to not be reaching as much with our massage. So we do want to ensure we get into those corded areas immediately, into the hard areas immediately. Not just work them directly, but work the sites that are leading into those areas and moving that fluid out. And very quickly you can see that go down within one session. So we're definitely tracking the whole time you're coming in. Are you getting lumps and bumps? Let's address these right away. Are you getting any signs of cording? Let's address them right away. The prevention value of getting in there immediately is just above and beyond what I can even explain, because when cording or lumps and bumps go unseen and untreated, this becomes scar tissue, and it is so much harder to get rid of if we don't address it immediately. So that's kind of second week. You'll start to see that fibrotic tissue can be lumpy and bumpy, or it can be really hard and squishy. Again, this is really high protein filled fluid tissue that we want to work out manually with lymphatic drainage, and utilize the other tools that we have at our clinic to help you. Red light therapy, the compression therapy, all of these things, the combination of the 3 things that we use for surgery recovery is really incredible. So once you get through your fibrosis stage, your possible cording stages, You've gotten past any chances of infection. You've gotten through your pain and your swelling. This usually happens by the end of the the end of the 4th week. So you would have been 4 weeks into treatment. 5th week, we start to work on your results. How can we start to make you feel and look amazing, like the reason you went in the first place? So we will start to work on deeper modalities with the vacuum therapy technology to sculpt those beautiful lines along your waist, along your hips, and that is where it gets really exciting. Also, all along the way, we do want to track compression garments. We want to track if we want to add foam to certain areas. We now have fibrosis foam that is phenomenal that we can put in those areas that you can take home. So in the 4th week, we may want to use another garment that's tighter and more sculpting. And so we also want to reassess your garment and see if it's the right garment for you. So the 5th and 6th week is all about sculpting and making you look amazing. Some clients will continue their care and they'll do another 6 weeks of treatment. Some clients will do 3 treatments a week instead of 2. Why would we do more or less? Well, the more surgery you have, the more lymphatic drainage you're going to need. So again, I would recommend talking to your therapist about that. But in general, with all the advanced techniques that we have, we want to get you better in 2 to 6 weeks, seeing you anywhere from 2 to 3 times a week. I hope that helps. Answering your questions about lymphatic drainage today was all about surgery.